Hello future nurses. Welcome to this video series of Q&A for Nursing Fundamentals Volume 1 and 2. Chapter 5 Fluids and Electrolytes. 1. The nurse prepares to change the client's central line dressing. Place the steps of the procedure in correct order. A. Remove the old dressing. B. Remove and discard gloves. Perform hand hygiene. C. Don a mask and have the client don a mask. D. Apply the new dressing. E. Cleanse the site. Apply the new dressing. E. Cleanse the site. Correct answer, C, A, B, E, and D. Explanation. The correct steps for performing a central line dressing change is as follows. Don a mask and have the client don a mask. Remove the old dressing. Remove and discard gloves. Perform hand hygiene. Cleanse the site. Apply the new dressing. 2. The nurse prepares to administer a medication through the client's central line. Per hospital policy, the nurse must use heparin to keep the line patent. Place the steps in the correct order for administering medication through the central line. A. Administer the medication. B. Flush the catheter with 5 ml saline. C. Flush the catheter with heparin. D. Flush the catheter with 10 ml saline. Correct answer, D, A, B, and C. Explanation. The process to administer medication through the central line is as follows. Flush the catheter with 10 ml saline. Administer the medication. Flush the catheter with 5 ml saline. Flush the catheter with heparin. 3. The nurse cares for a client who is sedated, intubated, mechanically ventilated, and has a central line. While repositioning the client, the central line is disrupted. Place the steps in correct order in response to the clinical scenario. A. Place the client in supine position. B. Clamp the affected lumen with a soft-tipped clamp. C. Place a strip of tape over the catheter. D. Notify the healthcare provider. Correct answer, A, C, B, and D. Explanation. If a central line is disrupted, the nurse should first have the client perform the Valsalva maneuver. However, this client is unable to do so. In this case, the correct steps are as follows. Place the client in supine position. Place a strip of tape over the catheter. Clamp the affected lumen with a soft-tipped clamp. Notify the healthcare provider. 4. The nurse is teaching a client on the importance of monitoring intake and output at home. Which statement will the nurse include in the client teaching? A. Weigh at 2 different times during the day in order to see a change. B. If your weight goes up more than 1 pound in a day, contact your healthcare provider. C. If you notice sticky mucous membranes, contact your healthcare provider. D. Weigh with 2 different scales in order to compare results. Correct answer, C. Explanation. Sticky mucous membranes may indicate a fluid volume deficit and the client should report this finding to the healthcare provider. The nurse should teach the client to weigh at the same time during the day, using the same scale, wearing similar clothing in order to provide accurate weights. The nurse will teach the client that if their weight goes up by more than 0.9 to 1.3 kg, 2-3 pounds, per day to contact the healthcare provider. 5. The nurse is assisting the healthcare provider insert a central line for the client. During the procedure, the client reports sudden shortness of breath, and the client's SpO2 falls to 88% on room air. Which actions will the nurse take? Select all that apply. A. Place the client in the left side lying position. B. Lower the client's head of the bed. C. Raise the client's head of the bed. D. Apply 100% oxygen via mask. E. Prepare for intubation and mechanical ventilation. Correct answer, A. Explanation. The client is likely experiencing an air embolism, a potential complication of central line placement. The nurse should place the client in the left Trendelenburg position, side lying, with the head of bed lowered. Additionally, the nurse will apply 100% oxygen via mask. Although the client is experiencing shortness of breath, the nurse will not yet prepare for intubation and mechanical ventilation. 6. The nurse plans teaching for the client on methods of encouraging fluid intake. Which statements will the nurse include? Select all that apply. A. Consume 180 milliliters of water daily. B. Limit your alcohol intake. C. Avoid excess amounts of fluids high in salt. D. Moderate caffeine intake is acceptable. E. Consume 6 to 8 glasses of water daily. Correct answer, B, C, and E. Explanation. When teaching a client on methods of encouraging fluid intake, the nurse will suggest the client consume 6 to 8 glasses of water daily, and avoid excess amounts of fluids high in salt. 180 milliliters of fluid is not enough fluid intake daily, and caffeine promotes diuresis, which is counterproductive to fluid intake. 7. The nurse prepares to insert an intravenous catheter in an older adult client. Which actions should the nurse take? A. Use a tourniquet prior to assessing the insertion site. B. Keep the tourniquet applied until the infusion set is attached. C. Insert the catheter in a distal vein. D. Insert the catheter in a proximal vein. Correct answer, C. Explanation. Older adult clients' veins are fragile and roll easily, and frequently the needle punctures the wall of the vessel. The nurse should insert a small gauge, short catheter in the distal vein first to preserve proximal vessel. A tourniquet may not be necessary and if used, should be applied loosely for a short period of time. 8. The nurse is caring for a client who is receiving intravenous therapy with an infusion pump. An occlusion alarm sounds. Which things will the nurse check? Select all that apply. A. IV site. B. Pinched tubing. C. Closed clamp. D. Client positioning. E. Bubbles in the tubing. Correct answer, A, B, C, and D. Explanation. An occlusion alarm is a common alarm that sounds on the infusion pump. This occurs when the pump cannot maintain delivery in the face of increasing resistance. The nurse should check the IV site for infiltration, pinched tubing, clamps for closures, and the client positioning. Bubbles in the tubing causes an error in the tubing warning. 9. The nurse prepares to change the client's central line dressing and replace the injection cap. Which position will the nurse place the client? A. Supine. B. Upright. C. High Fowlers. D. Side lying. Correct answer, A. Explanation. The client should be positioned in the supine position because head of bed elevation increases the chances of an air embolism forming. Upright, high Fowlers, and side-lying positions are not the correct positioning when changing the client's central line, dressing and replacing the caps. 10. The nurse needs to obtain blood samples from the client's central line for blood analysis. Place the steps of the procedure in correct order. A. Withdraw 10 milliliters of blood and discard. B. Flush with 5 milliliters normal saline. C. Inject 5 milliliters heparin. D. Draw up the required blood and transfer to the appropriate containers. E. Clean the infusion access port according to policy for 10 seconds. F. Clean the infusion access port according to policy for 30 seconds. Correct answer, F, A, D, E, B, and C. Explanation. A. The steps of obtaining blood for analysis while drawing from a central line is as follows. Clean the infusion access port according to policy for 30 seconds. Withdraw 10 milliliters of blood and discard. Draw up the required blood and transfer to the appropriate containers. Clean the infusion access port according to policy for 10 seconds. Flush with 5 milliliters normal saline. Inject 5 milliliters heparin. 11. Calculate the flow rate of the following intravenous therapy prescription. 3 liters 0.9% normal saline over 24 hours. A. 125 milliliters per hour. B. 100 milliliters per hour. C. 250 milliliters per hour. D. 90 milliliters per hour. Correct answer, A. Explanation. The formula for calculating flow rate is as follows. Equals ml/HR. 3L equals 125 milliliters per hour. 12. The nurse is setting up an intravenous infusion for a client, and the nurse has set the IV pump according to the healthcare provider's orders. How will the nurse best verify that the drop/minute rate is correct? A. Verify the tubing size and adjust accordingly. B. Verify the flow rate on the infusion pump. C. Count the drops in the drip chamber for 6 seconds and multiply by 10. D. Count the drops in the drip chamber for 15 seconds and multiply by 4. Correct answer, D. Explanation. In order to verify that the drops/minute rate is correct, the nurse will count the drops in the drip chamber for 15 seconds and multiply by 4. Counting the drops for 6 seconds is not long enough and is not accurate. The other answer choices do not verify that the drops/minute rate is correct. 13. The nurse cares for a client with a Piccc line that requires a dressing change. Place the procedure steps in the correct order the nurse will perform. A. Remove old transparent dressing. B. Discard old dressing and gloves. C. Perform hand hygiene and don clean gloves. D. Assess the exit site. E. Perform hand hygiene and don sterile gloves. F. Clean the exit site and catheter with antimicrobial swabs, allow to dry. G. Place securement device and cover exit site with transparent dressing. Correct answer, C, A, D, B, E, F, and G. Explanation, A. The correct steps to perform a Piccc dressing change is as follows. Perform hand hygiene and don clean gloves, remove old transparent dressing, assess the exit site, discard the old dressing and gloves, perform hand hygiene and don sterile gloves, clean the exit site and catheter with antimicrobial swabs and allow to dry, place securement device and cover exit site with a transparent dressing. 14. The nurse removes a client's intravenous catheter and notes the tip of the catheter is broken. The nurse palpates the client's arm and feels the broken piece. Which actions should the nurse take? A. Apply ice to the insertion site. B. Raise the client's arm above the heart. C. Apply a pressure dressing on the insertion site. D. Apply a tourniquet above the insertion site. Correct answer, D. Explanation. If the broken piece of a catheter is palpated, the nurse should apply a tourniquet above the tourniquet to decrease the risk of the piece migrating to the heart or lunges. The other answer choices do not represent adequate action to take when an intravenous catheter is broken. 15. The nurse administers intravenous fluid therapy using a dial-A flow device. What is the disadvantage of this device that the nurse recognizes? A. It does not control the size of the drops delivered. B. It does not allow for a fixed flow rate. C. It does not allow a specified number of drops in the drip chamber. D. It does not allow visual calculation of the flow rate. Correct answer, A. Explanation. The dial-A flow device is a gravity-controlled infusion device that has a manual controller with a dial that allows for a fixed flow rate. Because the device cannot control the size of the drops dispensed, it is not as accurate as an IV pump. This device allows a specified number of drops in the drip chamber and allows for visual calculation of the flow rate. 16. The nurse cares for a client with a central venous catheter. Which action by the nurse is incorrect when maintaining the client's central line? A. Wiping the access port with an antimicrobial swab for 30 seconds. B. Using a 5 ml syringe to flush the catheter. C. Flushing the catheter before and after each dose of medication. D. Using a push-pause-push motion to flush the catheter. Correct answer, B. Explanation. When maintaining the client's central line, the nurse will use a 10 ml syringe instead of 5 ml because smaller syringes can exert too much pressure, which can damage the catheter. The nurse will wipe the access port with an antimicrobial swab for at least 30 seconds, will flush the catheter before and after each dose of medication, using a push-pause-push motion to flush the catheter. 17. A nurse attempts to flush the lumen of a triple-lumen central catheter and notes severe resistance to flushing. Which diagnostic procedure does the nurse anticipate when assessing the correct placement of the central line? A. Chest CT. B. Fluoroscopy. C. Chest X-ray. D. Endoscopy. Correct answer, C. Explanation. The nurse should anticipate the healthcare provider ordering a chest X-ray when determining the placement of the client's central line. The chest CT may be performed. However, this is not the most likely diagnostic test. Fluoroscopy will be performed if an occlusion is suspected. Endoscopy is performed when there are issues with the upper or lower GI system. 18. The nurse cares for a client with an intravenous infusion of D5NS. Which complications will the nurse closely monitor the client for? Select all that apply. A. Increased serum sodium. B. Decreased serum potassium. C. Fluid overload. D. Hypotension. E. Increased serum chloride. Correct answer, A, C, and E. Explanation. D5NS is a hypertonic intravenous solution, which promotes osmosis of fluid out of the cells. Complications of D5NS therapy is hypernatremia, elevated serum sodium, fluid overload, and hyperchloremia, increased serum chloride. Hypotension and hypokalemia, decreased serum potassium, are not complications of D5NS therapy. 19. The nurse cares for a client with a triple lumen central line who develops a fever, which the nurse suspects is from the central line. Which nursing actions are appropriate? Select all that apply. A. Replace the infusing TPN with normal saline. B. Change the IV tubing. C. Remove the IV using sterile technique. D. Change the IV dressing. E. Culture the insertion site using sterile technique. Correct answer, A, B, D, and E. Explanation. If the nurse suspects the central line may be the cause of infection, the nurse will replace any nutrition or blood infusing with normal saline, change both the IV tubing and dressing, and culture the insertion site using sterile technique. The nurse will not remove the IV without the order of the healthcare provider. 20. A novice nurse performs care of a client's central line. Which action by the novice nurse requires intervention by the nurse preceptor? A. Changing a clean gauze dressing that is 48 hours old. B. Changing a clean transparent dressing that is 72 hours old. C. Scrubbing the insertion site with antimicrobial solution for 30 seconds. D. Placing an impregnated antimicrobial dressing on the insertion site. Correct answer, B. Explanation. Care of the central line involves ensuring sterile technique and replacing dressings when needed. A clean and intact transparent dressing may be left in place for up to 7 days. A gauze dressing for a central line needs to be replaced after 48 hours, even if the dressing is dry and intact. Scrubbing the insertion site with antimicrobial solution for 30 seconds, and placing an impregnated antimicrobial dressing on the insertion site are both correct actions when caring for a client's central line. 21. After removing a client's intravenous catheter from the upper extremity, the nurse notes the client has persistent bleeding despite applying firm pressure. Which action will the nurse take? A. Hold the client's arm above the level of the heart. B. Place the client's arm in the dependent position. C. Lower the client's head of the bed. D. Apply a tourniquet to the client's arm. Correct answer, A. Explanation. If bleeding persists after applying firm pressure, the nurse should hold the client's arm above the level of the heart to decrease blood flow to the extremity. The other answer choices do not decrease the risk for bleeding and may make the client's condition worse. 22. The nurse attempts to secure and stabilize an IV catheter and dressing of an older adult client. Which nursing action is appropriate? A. Use roll-type gauze to cover the IV site. B. Apply skin protector solution prior to dressing the IV site. C. Use extra tape to attach to the client's skin. D. Apply lotion to the client's skin prior to dressing the IV site. Correct answer, B. Explanation. Securing and stabilizing an IV catheter and dressing of an older adult client can be challenging due to the client's fragile skin. The nurse should apply a skin protector solution prior to dressing the IV site to help protect the skin. Additionally, the nurse should use stretch mesh gauze to cover the site, not roll-type gauze. The nurse should avoid using tape as this increases the risk of injury. Application of lotion would impair, not improve, securing and stabilizing an IV catheter and dressing. 23. The nurse cares for a client with traumatic injuries due to a motor vehicle accident. The nurse wants to increase the intravenous flow rate of intravenous fluids infusing. Which actions will the nurse take? Select all that apply. A. Insert a large bore IV catheter. B. Warm the IV fluid prior to infusing. C. Cool the IV fluid prior to infusing. D. Insert a long IV catheter. E. Use a microdrip IV tubing set. Correct answer, A, B, and E. Explanation. There are situations where intravenous fluid therapy needs to be infused rapidly. Methods to improve the rapid infusion of intravenous fluids include inserting a large bore IV catheter, warming the IV fluid, and using a microdrip IV tubing set, which will provide larger drops of fluid per minute. Cool fluid infuses slower, as do longer IV catheters, due to increased resistance,